Davao City is now under enhanced community quarantine as the number of COVID-19 positive cases continues to rise. RTV 1 Mindanao's Real Soroches has the detail.
Alan, at exactly 9 o'clock tonight, Davao City has been placed under enhanced community quarantine, prompting authorities to implement stricter measures to prevent the spread of COVID-19. The Davao City government has declared a 15-day enhanced community quarantine over Davao City starting 9 o'clock tonight. Under Executive Order number 23, signed by Mayor Sara Duterte, all government offices must implement work-from-home schemes and allow only a minimal number of employees to continue delivering services. All private establishments must also close except for those involved in health, food, security, money transfer, emergency services, and other essential sectors. Jeepneys are no longer allowed to travel except for those that will be hired as service for the offices and sectors which will remain open. When going out, all residents must bring a valid ID or their food and medicine pass, which will be used to buy food and medicine or to go to the hospital. Liquor ban is still in effect from 5 p.m. to 8 a.m. Minors, senior citizens, pregnant women, or those who are sick are not allowed to go out except when they need to go to the hospital. Everyone is asked to always wear a face mask when outside. Meanwhile, 11 people who visited New Davao Matina Galera, a cockfighting arena in Davao City, have tested positive for COVID-19. 3 have already died, as more cockfighting enthusiasts who attended the activity tested positive of the disease. The Department of Health explained that a COVID carrier has a 2.5 declared reproductive rate of the virus, which means that he or she may transfer the virus 2 to 3 other people near him or her. In a crowded place such as a cockfighting arena, chances of droplet transmission is very high, especially that the said cockfight ran from March 6 to 12. DOH further explained that when a COVID carrier coughs or sneezes, around 3,000 to 100,000 droplets get emitted and travel at a speed of 80 to 160 kilometers per hour that can reach another person or stick to surfaces. Just this week, one of the country's sub-national laboratories, the Southern Philippines Medical Center, has earned a Stage 5 classification or full-scale implementation for COVID-19 testing from the DOH, allowing it to test and release confirmatory result for COVID-19. The SPMC can test an average of 70 to 80 samples per day and aims to release results within 24 to 48 hours. In Cagayan de Oro City, the first batch of health professionals, composed of 40 medical personnel from Northern Mindanao Medical Center, have tested negative for COVID-19. They were placed under 14-day mandatory home quarantine after handling COVID-19 positive patients in the said hospital. In Zamboanga del Sur, a 7-year-old boy from Dumalinaw town is the youngest COVID-19 positive patient in Mindanao. He traveled to Iligan City last March 14 and went home the next day. He experienced light symptoms for 4 days and was admitted at a private hospital in Pagadian City. He was confirmed COVID-19 positive last April 1. He is now confined at the Zamboanga del Sur Medical Center. Meanwhile, a 30-year-old mother who just gave birth and a resident of Barangay Tetuan is the third COVID-19 positive case from Zamboanga City. She is a diabetic with no travel history. She had an exposure with a person who had a travel history in Manila last March 12. She experienced fever, cough, and LBM last March 19 while undergoing home quarantine. She was admitted at the Zamboanga City Medical Center last March 27. While she was on her 36th week of pregnancy, a swab sample was immediately taken before she gave birth last March 28. She tested positive for COVID-19 on April 1. She is now in stable medical condition. Authorities ask the cooperation of Mindanaoans to ensure their safety against COVID-19. Alan.
Thank you, Real Soroche.